Hello everyone, good morning. I'm Steve from UCAN English Tutoring. In this video, I'm going to assess one of the letters written by a student on Miss Sarah Keating's case notes. This is one of the nursing case notes and she has written down this letter. Firstly, I would like to assess the letter and then we can go through the case notes. Let's start with the assessment of the letter. So she has written down Miss Jane Piper, district nurse. There's a spelling mistake. Can you see this here? So it is DISTRIC. No, it should be DISTRICT. Is that right? Villa,
Yes,
are
sir.
you able to see that? Yes.
Yeah.
So instead of writing down district nurse, you wrote district nurse. That's not correct. So you should write district nurse. Okay. That's going to be the correct way of writing down the spelling. All right. Okay, let's go ahead with the next one. Scarborough Beach City Council, the Esplanade, and then you have written down Scarborough Beach 6019. That's okay. So I'm quite happy with the remaining things. So you were able to write down everything correctly except this. Okay.
Yes.
So when we have to copy the details of the recipient, we need to be very careful because we should not commit even single mistake, because these details are just going to be copied from the question paper to the answer sheet, isn't it? So you should not commit any mistakes here, please.
Yes, sir.
Yep, perfect. So you have written on the date after that, which is going to be 05/10/2010. That's okay. I'm quite happy with that. And then dear Miss Piper. So Piper is the surname of the patient. Okay, that's good. And you have written on the correct prefix as well. I'm quite happy with both of them. So that's good. After that, you wrote the reference details of the patient, that is regarding Miss Sarah Keating, 20 years old. That's good. I'm quite happy with that. All right, let's go through the introduction paragraph. I'm writing to update you regarding this patient who is recovering from infection of skin graft on a right forearm. Okay. So when you add the third information, you need to place a comma here, but it is okay. Here it is not needed. Okay. So I'm writing to update you regarding this patient who is recovering from infection of skin graft on right. Now it should, there's one mistake here. Infection. Okay. It should be on the right forearm. Okay. That's going to be the case. All right. Just 1 second. So when you write down the part or the location of a body, you have to use either his or her or the, because that's going to be a particular part. So you have to be able to write it down. For example, in this case, it's going to be the right forearm. Instead of saying, let's say you wrote right forearm, isn't it?
Yes.
So you should write the right forearm. Is that clear with you?
Yes, sir.
Otherwise, you can say her right forearm. That is also fine. You can write either the right forearm or her right forearm. Okay. So please understand that the body parts require an article that is the. Okay. All the body parts or whatever you write, that's going to require an article the. Okay, let's see. She requires home visits to continue the ongoing care as she is being discharged today. Okay, there are a couple of mistakes here. She requires home visit. Okay, home visit, let's say when you write down home visit, okay, it is a countable noun, which means if it is a single visit, then you have to write down a home visit. If it is multiple visits, then you have to write down home visits. So what's the situation in this question, Villa? Is it one visit only or multiple visits?
Multiple visits, sir.
Then it is going to be home visits only. Okay, here.
Yeah.
All right. So let's eliminate this one. So you need to be a bit careful about the countable and the uncountable nouns. Okay.
Yes.
Because the countable nouns always require an article before them, and the uncountable nouns do not require. All right. So in this case, she requires visits to continue the ongoing care as she is being discharged today. Okay, with the being, all right, we need to use the past participle verb only. So you mentioned being discharged. Discharge is the present verb, right? So it is wrong. So you should say being discharged. It's going to be ed at the end. All right, so that's how you need to write. Okay, there are a couple of mistakes here. So I don't know why many people, commit these mistakes. Being discharged, being done, being completed, being finished, being prescribed, being blah blah blah, whatever it is. It's going to be the third form of the what do you call the verb? It's going to be the past participle verb. Please, during 3 days hospitalization. No, this is wrong. During 3 days hospitalization. Okay, what you should have mentioned is during 3 days hospitalization. I mean, we don't need to make ourselves commit more mistakes. It's okay to write down during hospitalization. That's it. It is absolutely fine. There is no harm. They are not going to tell you why you didn't write down 3 days here. Do you know what I mean? But this one is wrong. So it's not going to be. So you can write even during her hospitalization. That is more appropriate as well. During her hospitalization or during hospitalization, and then you can write down her name after that. Miss Keating's infection was managed with the ampicillin antibiotic. Okay, antibiotic is going to be one word only. You don't need to place a hyphen in between them. Okay, so you wrote antibiotic, isn't it? So that's not correct. So antibiotic doesn't require any hyphen in between. Okay, so you don't need to write like this. It's going to be just antibiotic without any hyphen in between. Is that clear with you?
Yes, sir.
Okay, let's continue now. Through intravenous, spelling is correct. Through intravenous line. Okay. Wound healing, wound dressing was performed to treat a lesion on, okay, again, on forearm. Okay, so you wrote on forearm. Remember that it's going to be on the forearm, or in this case, it can be on her forearm. So either of them is okay. Remember this, with all the parts of the body, you need to place an article the in front of them. So if this is your frequently made mistakes, okay, during your writing, I would strongly recommend you to take this as one of the areas of inspection when you do the proofreading. I mean, throughout the letter, you have to go through and find out whether there are any body parts that you have written down in the letter. And then, check whether you have used the in front of that body parts. Is this clear with you?
Yes,
So
sir.
this is how we need to do the proofreading. It's very easy. Proofreading is going to be super easy as long as you understand what kinds of mistakes you are commonly committing, and then you go through the letter accordingly. All right. So in your case, you have to go through the whole letter to find out whether you have mentioned any body parts, for example, shoulder, arm, neck, head, forehead, forearm, leg, all right, knee, hip, whatever it is. Okay, so whatever the parts of the body that you get, you have to go across those in sentences and then see whether you have placed the article the or his or her. Any one of them should be placed over there. If you didn't place them, you have to be able to modify them. You have to insert them, okay, accordingly. Is this clear with you?
Yes, sir.
Perfect. All right, let's go through the next one. As the wounds condition has improved, that's all right. Bandage cover is no longer required. That's okay. I'm happy with that. There's no issue. In regard of, okay, we don't use in regard of. Okay, let's say in regard of. We will always use in regards to. Okay, in regards to. Otherwise, you can write regarding. That is also fine. Okay, in regards to Miss Keating psychiatric problem. See this one? When we write down, okay, 1 second. Miss Keating psychiatric problems. When we write down something which is going to be held by this person. For example, this noun holds this problem, isn't it? In other words, it is a possessive noun. Am I right? Because psychiatric problems are belong to this patient, that is Miss Keating. Am I right?
Yeah.
So in this case, we should use the apostrophes in order to indicate that it is her problem. So Miss Keating's problem. Miss Keating's psychiatric problems. Is this clear with you?
Yes, sir.
Right. These are the silly mistakes, but altogether they can make a huge impact. You don't want to fail, isn't it? Again, so we need to pass. So we need to be very careful. You have got two options, in order to deal with that. You can choose one of them. One is, when you write down the letter, you ensure that you don't commit more mistakes. Okay, you will commit only 2 to 3 mistakes. That's it. All right. Otherwise, you have to spend more time for proofreading. You can commit more mistakes, that's absolutely fine, as long as you give some time, let's say maybe 10 minutes, to proofread the whole letter and get the mistakes rectified. I'm quite happy with that. At the end of the letter, you should have committed many mistakes. You should have only very few mistakes. Do you know what I mean? Especially with these kinds of silly mistakes, you shouldn't commit. You should not commit, definitely. So in regards to Miss Keating's psychiatric problems, she had been visited by a psychiatric from psychiatric. Is that psychiatric or psychiatrist? What's going to be the case here? I don't think it's a psychiatric. Psychiatric is not the person, isn't it? Psychiatric is the, what you can say, psychiatric, therapy. So it can be it can be the treatment, right? But I don't think it's going to be the the person who is performing this activity. So it's going to be psychiatric. One second. Psychiatric. Okay, that's going to be a psychiatrist.
Yes.
Okay, I think that's going to be the correct one, because we need a person. She is visited by someone. So it could be either an occupation or a person or the name of a person. So in this case, it is an occupation. So by a psychiatrist from hospital, and future appointments were organized. Okay, when you say were organized, okay, okay, again and again I'm telling you, when you say were organized, isn't it? Were arranged or were organized. I don't know what you have written on. Okay, were organized. All right, let's go back. So were organized. Okay, you need to ask yourself, where, okay, this verb goes with the what subject, what noun should be before that. Definitely it should be we, or we were organized, or you were organized, or you were organized, or they were organized, isn't it? We can't use any singular noun. In other words, we can't use a singular noun here. He, she, it is wrong. Now let's go back here. So it's pretty easy to proofread. See, organized, let's go back. Where? Okay, good. Let's go back. There should be a plural noun here. Wow. It's a singular noun only. So future appointment is wrong. It is a singular noun. So what is going to be the case? Well, you need to ask yourself whether it was one single appointment or whether it was multiple appointments. What was the case in this situation? Is that one appointment only, or more than one appointment?
This weekly twice appointment.
So future
will be-
appointments were organized.
Okay.
So you should say future appointments were organized rather than future appointment. Okay. All right. 1 second. So when you check the verbs, you need to be really careful, because you need to ensure that you are using the appropriate nouns and verbs. You can't just simply use whatever you want. You cannot. You have to ensure that the nouns and the verbs are compatible with each other. I mean, they are suitable with each other. That's really important. All right.
Yes, sir.
Okay, perfect. Let's go through the next one. What's the next one? All right. From hospital, future appointments were organized. Okay, on discharge plan, ampicillin 250 mg tablet 4 times daily has been prescribed, which will be seized on 31st October. That is okay. But what is the spelling here? Can you tell me the spelling that you have written on here?
Let's see. I'm sorry.
It's not okay, isn't it? That's not good. October. This is wrong. You should use capital O and then CT. It's not okay, but it is OC. All right, October. I greatly appreciate if you could monitor Miss Keating adherence. Okay. It's this adherence belongs to Keating, isn't it? So Miss Keating's adherence. It's not Miss Keating adherence. That's wrong. Miss Keating's adherence, Miss Keating's dietary, Miss Keating's medication, Miss Keating's physiotherapy, Miss Keating's medication management, Miss Keating's insulin injections. Do you know what I mean? So you have to use the possessive noun. You can't write down like Miss Keating adherence. So which means there are two things. Okay, so Miss Keating and there is adherence as well. So there are two things, okay, that you are going to do. And this is wrong. It is only one thing. It is Miss Keating's adherence. That's it. Is this clear with you?
Yes, sir.
Please ensure that we don't commit those kinds of mistakes. So Miss Keating's adherence on medication, also her presence on psychiatric appointment that's scheduled. No, wait. Miss Keating. Okay, if you could monitor Miss Keating's adherence on medication and okay, also her presence on psychiatric appointment that's scheduled. Okay, no, this is wrong. Okay, you can't say that's scheduled. Okay, all right. And you don't need to even say that's scheduled, because you already mentioned the future appointments were already organized, isn't it, with the psychiatrist, right? You don't need to add anything here.
Okay.
Okay, one second. But there are a couple of other mistakes as well. And the other problem is, I greatly appreciate if you could monitor Miss Keating's adherence on medications. That's fine. You can also mention, her presence her presence, or she must present in psychiatric appointments as well. Something like that. You can add it maybe in the next sentence instead of writing down together here. Okay. All right, one second. Presence on psychiatric appointment. Okay. The problem here is that appointment that's scheduled. Appointments. One second. Which have been scheduled. Okay. So you can write like this. So they have already been scheduled, but you don't need to mention, all those things. But I'm saying this one is optional. You can just simply say, also ensure her presence on psychiatric appointments. That's it. With that, it is more than enough. You don't need to add anything else. Okay, let's continue with the next one. Oh yeah, that's twice a week. Okay, please supervise. Can you please tell me what it is?
Donor site.
Donor site. Okay, donor site as well as graft site for the possibility of infection. Recurrent. No. For the possibility of recurrent infection. Okay, or for the possibility of recurrence of infection. So infection recurrent is wrong. Why it is wrong? Well, recurrent infection means this recurrent is an adjective. All right. So what we have to do is recurrent infection is correct. Okay. In a sentence, adjective should be there first and then only the noun should come. It is not the other way around. If you write down a noun first and then an adjective, it's not going to be correct. Okay, let me give you a simple example. She is an intelligent girl. Okay, let's say she is an intelligent girl. That's the sentence. All right, this is correct. And this intelligent is an adjective which comes before the noun girl, isn't it? What's going to happen if I change the situation? Let's say she is an girl intelligent. Can we write like that? Can we say so? She is an girl intelligent.
Should be intelligent girl.
It doesn't make sense, right? So if you would like to avoid this, there is another way as well. You can also say, for example, recurrence of the infection. That is also correct. You can use another noun, recurrence of the infections. You can also write like this. That is also good enough. I mean, the whole sentence can be written down like this. Please supervise donor site as well as graft site for the possibility of recurrence of the infections. Okay, that is going to be more appropriate. But you have added few more things as well, isn't it? Some interference on site could be developed. Oh my God, could be developed since wound uncovered. No. Okay, it's better to split this one into the next sentence rather than writing them down together one by one. Do you know what I mean? So after the recurrent, okay, after the infection, it's better to put a full stop and start a new sentence. So what you should have done is some interference on site could be developed. Okay, some interference. Okay, when used could be, all right, remember that we require the third form of the verb only after that. So it's going to be could be developed, but what you have mentioned was could be developed, isn't it? So could be developed. All right, that's going to be the more appropriate one. Could be developed. All right. Since wound uncovered. Okay, that's wrong. Since wound is uncovered. Since wound uncovered. Okay. After since, we require a full sentence. Okay. Wound uncovered. Is it a complete sentence? I don't think so. Since wound is uncovered. Is that clear with you?
Yes, sir.
So since wound is because wound is uncovered. Since needs to be replaced with the because. You can also use because, and then you can read this whole sentence and see whether it is making sense. Because wound is uncovered. Because wound uncovered. Do you know what I mean? So because wound uncovered doesn't make sense. Or as wound uncovered doesn't make sense as well. So it is better to use as wound is uncovered, since wound is uncovered, because wound is uncovered. Is that clear with everyone?
Yes.
Okay, let's go ahead with the next one. And this on site, okay, it can be written down into two words. That's one mistake which I wanted to highlight as well. It sounds like one word. It's better to write down it into two words and give good space between on and site. All right, thank you for your assistance. If you have any queries, please do not hesitate to contact me. Yours sincerely, Registers. You don't need to give these many blanks. These two go together. I mean, one line after the other. So you have to write down register nurse here. They go together. Is this clear with you, Villa?
Yeah. Okay, sir.
Perfect. All right, let's go ahead with the case notes now, and let us discuss the case notes. Okay. All right, the case notes, these are the ones. Okay. So firstly, when you get the case notes, what you need to do is you have to scroll down to the end and then understand the writing task. Then you can go up and then start looking at the case notes. So we need to use the relevant information in the discharge plan. Write a nursing letter about Sarah Keating to Miss Jane Piper, district nurse, Scarborough Beach City Council. The Esplanade, Scarborough Beach 6019, asking for follow-up care. So it's going to be the continued care, ongoing management. Okay. All right. So Miss Piper has been visiting Sarah twice weekly during her hospitalization. So Miss Piper has already been visiting, which means that's a known case. All right.
Yeah.
And is familiar with their history. They also clearly stated. Okay. So that's not needed. Main part of the letter should be 180 to 200 words long. Okay, no more than 25 lines. But you know, these no more than 25 lines is no longer a requirement. It is only the words. Okay, do not use note form, use letter format, use full sentences. You know, you need to write down always in an expandable manner. You should not use any abbreviations. It's not good. Okay, all right, let's continue now. Okay, so it's going to be nursing. So she knows, and she knows the patient, and we require follow-up care from the recipient. That's it. Okay, good. Let's continue here. So the patient's name, so you have included that, it's good. And then 20, that's good. And unemployed, I mean, she must know all these things, these ones. And then this patient has been in your care and is going from hospital, read the case notes, that's fine. Admitted, that's all right. Okay, due for discharge today, that's okay. Infection on skin graft on right forearm. Okay. When we see the case notes, one thing I would like to request to my students is that the case notes should have lots of grammar mistakes. They should have. All the case notes will have at least some grammar mistakes, at least some. One of them could be the inappropriate use of articles. I mean, they might have not used the articles. For example, instead of writing down the right forearm, they don't write the right forearm. They will only write right forearm. That's it. Or sometimes, R forearm, okay, or L forearm. All right. So this means it is your responsibility. It is your accountability to expand these things into complete sentences with the accurate use of an article. You can't write simply the one that you see here in the case notes. You can't copy and paste there in your letter. You should not do that. Please don't do this. Please don't do this. It is going to make your score go really low. It can drag your score to 250 or 260 or less than that. We need to interpret the information. We need to identify the grammatical errors in the case notes, and we have to correct them when we write down the letter. That is the task. That's what they have given you here, because these are just the case notes form only. They are the notes form only. They are not the complete or correct sentences. Everyone should understand this, please. And I have been already telling so many times, isn't it? So please understand that. So medical history is going to be psychiatric problems, depression, previous episodes of self-mutilation. We don't need to worry about that. And then previous admission on 5 September 2010 with the burns to the right forearm, suspected self-harm. Let's go back. Yeah, it's already known, because she, the recipient has been already visiting her, thrice a week, isn't it? Discharged on 15 September following skin graft. So these things are already known to the recipient. So we don't need to worry about them too much. And I hope you didn't include any of them. Did you include any of them?
No, sir.
Okay, right. And the nursing notes are daily dressing to lesion on forearm, and then area now left uncovered. Yes, now. Okay, so it means it is a current thing. So they didn't include, the recipient does not know this. Why? Because it happened just now only, which means you should include this in your case notes, or in your letter, sorry. So that's done, you did it. And whenever they use these kinds of things, now, recently, presently, at present, currently, if they use these kinds of phrases, it means they are trying to give some kinds of clues to you that these are the relevant ones, and you have to include them. Seen by the hospital psychiatrist, these are the recent ones only, so you have to mention that. And you have done that anyway, right? And see, this one, psychiatrist, has been mentioned here with the ST. It's not C. The problem is, sometimes we may be careless. Sometimes we may be overconfident about the spelling of a word, and we don't care about the spelling here. When they use the occupations, usually the spelling is going to be correct in the case notes. Is this clear with everyone?
Yes, sir.
And you are just going to copy and paste this. So we should not commit any mistakes, please. These are the silly mistakes, but they can cause so much negative effect on your score, and we don't want that from happening. We have to prevent them. Okay, please. All right, let's go to the next one. Family. Lives with the parents and younger brother. He knows everything. Okay, the whole family history. So we don't need to include them, and you didn't include that, I hope. So that's really good. So we have to go through the discharge plan. Continue oral ampicillin, 250 mg QID. All right, to cease on 31st October. Yeah, you have written down this one. I'm quite happy with that. Monitor graft site and donor site. So instead of using, monitoring, did you use any synonyms, observe or something else?
Just supervise.
Sorry, supervise. Okay.
Yeah.
Instead of supervise, it's much better to use observe. All right.
Yes, sir.
Okay. Yes. Graft site and donor site. Okay. On thigh for signs of infection or interference. Okay. That's good. And you tried to develop into sentences, but unfortunately you failed in terms of grammar. All right. Monitor compliance, medications twice weekly, visits to psychologist. So there's a psychologist as well. Psychologist appointments already organized by hospital. Okay. Wait, there are a couple of issues here. I will tell you what it is. Look at the psychiatrist. So during hospitalization, the patient has been visited by a hospital psychiatrist. Okay. So remember this psychiatrist is different from this psychologist, isn't it? Can you
Yes.
have a look at it? Okay. So what you should have done in your letter is you should have included these two information appropriately. Did you include them or not? Let's go back here. Okay, so that's here. And future appointment were organized. No, unfortunately, this has been done by the psychiatrist only from the same hospital. However, it is a different person, who is going to visit this patient, or with whom the patient is going to have consultation after discharge. So that's going to be a different person. It's not the same person. Can you see this here, please? So
Yes,
the
sir.
hospital, okay, so there are two things. Okay, I will tell you one. The first thing is, during hospitalization, usually the hospital will not arrange a psychologist outside from the hospital. They will have their own psychologist or psychiatrist who will visit the patient and monitor his progress or her progress. Okay, that's what done during the hospitalization here. Do you see the nursing notes? This is during the hospitalization. One of the hospital psychiatrists has visited this person and identified her problems and provided support. Okay, that's psychiatrist support. Okay, that's what they have done here. All right. But after the discharge from the hospital didn't organize their own psychiatrist. Instead, they have called ones who are going to visit the patient 3 times a week. Do you know what I mean? And it is a different person. It is a psychologist. And unfortunately, you haven't included this there in your letter. Am I right?
Yes, sir. My mistake. I didn't organize this psychiatrist and psychologist.
Yes.
Yeah.
So that's not correct. What you could have done is, instead of writing down this future appointment where organized, okay, from here, you should have mentioned, for example, and future appointments were organized with a psychologist. Okay, or you can say, you can remove this here. You don't need to even write the whole sentence here. This and future appointment were organized can be removed from here, and you could have mentioned it in the next paragraph, that is in the discharge plan paragraph. I mean here. So you can also mention, please note, comma, appointments with a psychologist has been already arranged by the hospital. Okay, so you could have mentioned this, something similar to that, but unfortunately you didn't do that. So you have misinterpreted the case notes. That's not good. That is definitely not good. And it's not a psychiatric appointment. No way, not at all. It's going to be a psychologist appointment with a psychologist, isn't it?
Yeah.
So unfortunately, you have misinterpreted the case notes dramatically, and as a result, this is going to have a boomerang effect on your score. So I wouldn't be happy to give you even 250 for this letter, unfortunately. It's going to be less than that. Okay, let me check all the mistakes first. So the first thing is, you have committed spelling mistakes unnecessarily. These spelling mistakes are not that good, because you're going to copy and paste the district nurse from the case notes, isn't it? So when you go through the case notes, look at this one. They have used the district nurse here. Where is that? Yeah, 1 second.
Second line.
Oh yeah, second line. Yes, district nurse. It is DISTRICT. So that's the correct spelling, right? So we shouldn't commit these kinds of mistakes. These are the worst mistakes that anyone can commit, and that's not good for us. Okay.
Yes.
All right, so it's not really good. And then the use of articles is not good. And the nouns and plural nouns, verbs, no. Antibiotic, that's not good. On the forearm or in regards to, it's not, the use of prepositions is not good as well. Psychiatrist, you have changed the noun with an adjective. Psychiatric is an adjective. For example, a psychiatric appointment is different from an appointment with the psychiatrist. All right, future appointment, this is the use of tenses, and even this you change the spelling, that's not good. And you didn't use the nouns and verbs appropriately. So all these mistakes can definitely drag your scores. I'm not quite happy to give you a good score for this letter. I'm okay to give you only 230 out of 500 for this letter. Do you find it helpful?
Yes, sir. Very